Black and Hispanic children are impacted more severely by coronavirus, research shows. To view the full article, click the first link in the description below. Released Friday found that Black and Hispanic children are more likely to be hospitalized due to coronavirus than white children. The CDC examined hospitalization records from 14 states and found 576 COVID-19 cases among children who needed hospitalization from March through July 25. A report from the U.S. Centers for Disease Control and Prevention. The report found Hispanic children were hospitalized for coronavirus at the highest rate, 16.4 per 100,000 people, followed by Black children at 10.5 per 100,000. In contrast, white children were hospitalized at a rate of 2.1 per 100,000. The CDC also reported higher rates of multisystem inflammatory syndrome, or MIS-C, in these populations. Of 570 cases of MIS-C reported to the CDC by July 29, more than 74% were in Black and Hispanic children. MIS-C is a rare, but serious complication of coronavirus in children. Symptoms can include fever, rash, inflammation, stomach problems and shock. The condition can also lead to organ failure and heart damage. A study released this week out of Children's National Hospital in Washington, D.C., found that coronavirus rates are similarly higher among Black and Hispanic children and those from lower socioeconomic backgrounds. The study examined 1,000 patients tested at a Children's National COVID-19 testing site and found that just 7.3% of white children tested positive for coronavirus, in contrast to 30% of Black children and 46.4% of Hispanic children. 3 times as many Black children as white children reported exposure to coronavirus. Implications for reopening schools. Schools around the nation are currently making decisions about whether children will return to classrooms for in-person classes. A Georgia school district which reopened this week was forced to quarantine at least 260 students and 8 teachers after multiple members of the school community tested positive for COVID-19. While children do experience severe illness from COVID-19 less often than released Friday found that Black and Hispanic children are more likely to be hospitalized due to coronavirus than white children. The CDC examined hospitalization records from 14 states and found 576 COVID-19 cases among children who needed hospitalization from March through July 25. To view the full article, click the first link in the description below.